So as Sarah said, my name's Lindsay St. George, and today I've put together a demonstration to just kind of show the work that I've been working on for the past 2 years. And I've tried to give you some insight into how we actually collect the data, and then as Sarah said, I'm still actually in the process of analyzing the data, but today I'll be able to show you some of my preliminary findings. So I'm lucky enough to have Laura Whiteway with me here today, who's just warming up. She's a local show jumper, and she's got 13 horses in work. She's just come back from a really successful season in Spain. 2 of her horses are currently at Grand Prix level, and the rest range from 4-year-old to meter 40 speed. So we're really lucky to have such an experienced rider with us today. The horse that she's riding is her favorite horse. His name's Kentares. He's 14, and he's been very successful in meter 50 classes. So we'll be collecting some data off him today. So the main thing that we're going to be looking at today is how the equine muscles facilitate the jumping effort. So just a bit of background into why I started conducting this research. The FEI says that show jumping is its most popular sport. And the demands that we place on these equine show jumping athletes are immense. Especially with developments in the sport, we've seen tours like the Longines Global Champions Tour, which sees horses traveling all over the world for competitions. And the photo here is taken at Miami Beach, which is the first competition of the 2015 tour. And only 20 days after that, the horses traveled to Belgium for the second tour, and then to Madrid shortly after that. So we're putting a lot of demands on these horses. So we know that the jumping ability and performance potential of the show jumping horse is generally judged at a young age based on movement traits. So these movement traits are qualitative or they're subjective, and they're generally outlined by a stud book, or they can just be outlined by the personal preference of the person choosing the horse. As a result of this, a lot of biomechanics research has been done to try and quantitatively understand the jump technique in the horses. And a few studies have actually tried to figure out if some of these biomechanical or kinematic jump techniques can be used to predict performance later in life. So unfortunately, these studies have been inconclusive, and they suggest that movement alone isn't an accurate predictor of future performance. Furthermore, this research is generally not as readily available to the equestrian, so it's a little bit hard to apply it in practice. Okay, so science has told us that movement alone isn't an accurate predictor of future performance. Well, this is, fairly understandable if we look at horses like this, so BZ Madden's Cortez C, who obviously doesn't display our normal jump technique, especially in the forelimb that we would see outlined in stud books. So if it's not just movement, we know that quality jump technique has also been linked to inherent talent, training, or a combination of both. So in racing, we know that trainer and training methods are a huge factor in whether a horse is going to win a race or not. And actually, there's a lot of science behind the training of racehorses. But in show jumping, there's not a lot of research to show which training methods are the most effective in improving jump technique and performance in the show jumping horse. Now, in contrast to human athletes, I think we'd all agree that the training of horses is very anecdotal and traditional. There's not a lot of science behind what we do. In human athletes, we know that the drills and training are designed to mimic the duration and the intensity of the techniques that they use in competition. And this is the basis behind the anecdotal training in the horses, but actually there's not a lot of science to tell us which are the most effective and which are not. So we've talked about the biomechanics research that's been done and the lack of research into actual training of the show jumping horse. So what do we need to kind of fill this gap in knowledge or bridge the gap between these two areas? Well, this is why we're interested in muscles. So although biomechanics studies have told us about the movement of the show jumping horses, in order to comprehensively understand movement, we need to examine the muscles, which are the active components of the locomotor system. Furthermore, we know that muscular adaptation to training is really responsible for the horse being able to execute the jumps and the demands that we put on it in the sport. Also, muscular adaptation to training is essential for improving or maintaining performance and also decreasing the risk of injury. So we need to start, looking into this. And if, equestrians want to, improve training at the rate that human athlete training has been doing, we need to be able to implement scientifically evidenced methods into our anecdotal training regimes. So I think that this quote just really sums up why I've done this research. It's by Paul McGreevy, which most of you might have heard of, and that is that a horse appropriately conditioned and trained to carry riders correctly is likely to avoid many of the injuries that may otherwise be sustained. This underlines the need for more education of owners in appropriate musculoskeletal and behavioral conditioning, as well as equine biomechanics. So this brings me to the title of my PhD, which is Electromyographic Evaluations of Muscle Firing Patterns in the Sports Horse During Jumping, and his objective method of informing current jump training programs. So it's a bit of a mouthful, but it pretty much mimics the quote that I've just shown you. So obviously in the PhD, I had a number of aims and objectives that I needed to fulfill. And to fulfill these, there was a number of research questions that I had to ask. Obviously, because I'm still analyzing the data, I haven't been able to answer all of these questions, and also due to the time constraints today, I've chosen a few questions to present to you. And that is, do differences in muscle activity patterns occur between the canter and jump and between elite and non-elite jumping athletes? So obviously we would expect there to be differences, but science can tell us where these differences are occurring and how much they occur. And finally, can this information tell us about differences in muscle control between elite and non-elite jumping athletes? And the reason I wanted to answer these questions was that a better understanding of the optimal movement patterns, so the movement patterns that we use to judge the jumping potential of a horse, and the functional activity of the muscles that we know facilitates this movement that we look for, could provide an evidence base to objectively develop or modify current jump training programs. So to answer these questions, we needed to collect some kinematic data and also some data on muscle activity patterns. So for this research, we collect kinematic data using our 3D motion capture system, which we've set up for you over here. We also collect muscle activity data using electromyography, which I'll discuss in a little bit more depth in a moment, but it's essentially the technology that we use to measure muscle activity patterns. And this photo was taken at Laura's yard in August, where we collected data from some of her elite horses. So we use the Qualisys OCUS system to capture our motion data in 3D. They're infrared cameras. The system needs to be calibrated, which we've done before you came in, and it needs to be calibrated to create a volume, which you see in this photo, and within this volume is where the system can accurately reconstruct the positions of the markers that we use for movement tracking. So you'll see that in a moment. We use an extended calibration, so the cameras can be set up in a variety of ways depending on what you want to capture, but because we're looking to capture consecutive canter strides and obviously the jump stride, we set them up in a line and create an extended calibration like you see. So we track movement using anatomical landmarks, which we'll start putting on now if the horse is all warmed up. So essentially, when the horse travels through the calibrated volume, the infrared cameras shoot out infrared light, which is reflected off the markers, which are reflective markers that you'll see Danny putting on now. So it's reflected off the markers, travels back to the camera lens where it creates a video signal, and the marker positions are reconstructed in 3D space by the software. So the software that we use is called Qualisys Track Manager, or QTM, and this is what the markers look like when they've been reconstructed in 3D space, in a standing horse, obviously. Hopefully you can see, but these are the names of the anatomical locations that we use. This is a simple marker set, so essentially we're just getting data from the forelimb and the hind limb. And without going through all of them, just as an example of how we use these markers to look at kinematic data. So for instance, we see a marker on the proximal spine of the scapula and the greater tubercle of the humerus. So with those two marker positions, we can create a scapula segment. We can also use the greater tubercle of the humerus and the lateral epicondyle of the humerus to create the humerus segment. And with these two segments, we can start looking at shoulder angle. So hopefully you can see, but this slide just is a better representation of how the markers are actually reconstructed in 3D space. So you'll see the shape of the horse coming out in that. This is taken from a static or a standing trial, which we collect a standing trial before we get any of our dynamic trials. And this essentially acts as a baseline. So when we're analyzing our data, we can make reference back to the locations of the markers in the standing subject. Okay, so once we've got our marker positions from QTM, we transfer all that data into a different software program called Visual 3D. And in this program, we create the segments that I've just been describing. So for instance, we can see the scapula segment here and the humerus segment here. And we create all our segments to make an overall model of the horse. And using this model, we can look at things like joint angles, joint angular velocity, accelerations, displacements, etc. Okay, so now to discuss EMG, we use the Delsis-Trigno system, which you can see here, and it's surface electromyography, so the sensors are placed over the skin. So we're obviously limited to looking at superficial muscles. There's intramuscular EMG, which uses needle electrodes, and that allows you to measure muscles under the surface, so the deeper muscles. But obviously this is quite an invasive method, and we don't really want to be using needles in the jumping horse, so we use surface EMG. This is what one of the sensors looks like, and we'll place them on the horse in a moment. So how does EMG work? How do we get muscle activity from these little sensors that we put on the skin? Well, we know that muscle contraction and electricity are related. So muscles are composed of thousands of muscle fibers, which we see here, and these contract when they're stimulated by a nerve impulse. So motor neurons, which we're seeing here, start in the spinal cord, where they create nerve impulses that travel down the nerves and reach the muscles. So we use the term motor unit a lot in EMG, and a motor unit, just to clarify, is your motor neuron and all the muscle fibers that it innervates. So on this slide, you can see a motor unit innervating quite a few muscle fibers. So anyone with an exercise physiology background might remember that the resting potential of a muscle fiber is about -70 millivolts. And when the nerve impulse travels down and reaches the muscle, we get an alteration in this potential, and we get a contraction or a twitch, which is also referred to, which you're seeing in this center graph. So in order for the muscle to sustain a contraction, and these are the contractions that we see in movement, we need a number of motor units to activate or fire. And these, then we see a summation of the twitch, and we see in the last graph the type of contraction that you would see in movement, and it's also referred to as a tetanic contraction. So this is where EMG fits in. The EMG signal essentially captures the electricity from all the motor units that we're firing during a contraction. So the size of the signal, this is your typical EMG signal, the size of the signal relates to the number of motor units active. Okay, so to prepare the horse, yeah.
It's a little bit warm, so can you just either go skip a few and just and come back to it?
Okay. Yeah. Right, I'll come back to this one. So obviously with surface EMG, and when you want to look at the muscles, I was faced with the challenge of deciding which muscles do I actually want to investigate. So my criteria for selecting these muscles was A, obviously that they're superficial muscles, which you can see on the diagram here. This is a diagram of all the superficial muscles. B, the size of the muscle. So the bigger the muscle, the less chance you are to capture EMG signals from adjacent muscles or muscles underneath the muscle. So I wanted muscles that were quite large so that I knew I was getting an EMG signal just from them. And my last criteria was their actual contribution to jumping or cantering. So based on that criteria, I chose muscles from the forehand and also the hind limb. And the first muscle that I chose was the splenius. Now, the splenius is a major contributor to the head and neck, the apparatus, and it works to extend the neck, so to lift the neck up. When it's contracted unilaterally or on one side, we see lateral flexion of the neck. And obviously the neck, we know that the head and neck play an important role in balancing the horse over a jump. So this is why I chose this muscle. I chose the cervical trapezius. So there's two parts of the trapezius, the cervical one, which you see highlighted, and also the thoracic one. Oh, there. So the trapezius works to elevate the scapula. And obviously, elevation of the scapula is going to be very important at takeoff when the forelimb lifts up and the horse lifts its forelimb. I chose also the triceps brachii, which extends the shoulder and extends the elbow and flexes the shoulder. Again, this is a very important muscle during takeoff when we see the shoulder flexed and the forelimbs lifting. The superficial glute, this muscle works as a hip extensor, but a number of studies have actually described it as the muscle or a muscle that's responsible for a lot of the power created at takeoff. So this was a very important muscle for me to look at. And finally, the biceps femoris. This is also a hip extensor, and along with the gluteus medius, it's the largest and heaviest muscle in the pelvic limb, so in the hind limb. It's designed for a powerful contraction, so obviously we're going to be interested in this muscle at takeoff as well for producing the power to get the horse over the fence. Okay, so the horse is slightly warm. This is one of the problems that we run into with collecting data, this type of data. So the retroreflective markers that we use, we stick on with really heavy-duty carpet tape. And as soon as the horse starts to get warm, obviously the adhesion from the carpet tape starts to disintegrate, so we get more chance of the actual markers falling off. It's the same with the EMG sensors. To attach these on, the Delsys kit actually comes with its own stickers that fit over the electrodes, but those aren't really enough to keep them on the horse, so we supplement this with carpet tape as well and put them on. I'll just go back. Is there any questions now while we're getting the horse ready? No? Okay. So I'll just go back to the horse preparation slide for EMG. So in order to get the cleanest signal, so the signal that you just saw was a very clean signal, and that's our goal when we're collecting data from horses, which obviously isn't the easiest thing to do. It's a lot easier to collect data in humans. So in order to get the cleanest signal, we need to prepare the electrode-skin interface, so where the electrodes sit on the skin. So you should be able to see on Cantares now that we've shaved areas over the superficial muscles that we're interested in. So we've shaved an area here, and on the triceps there, and 2 on the neck. So by removing the hair, we can get contact with the skin, which is what we need to get our signal. We also use alcohol wipes to remove any dirt, dead skin cells, oil. That can also influence the clarity of the signal or the fidelity of the signal. So we clean those off before we put the sensors on. So any questions? No? Do you think I can start putting the EMG sensors on? Okay, so I'll start putting the sensors on. And what we're going to do is collect some kinematic and EMG data. I'll just use the alcohol wipes first. Okay, so we just take our alcohol wipes, which are just general alcohol wipes, and we just vigorously rub the areas that we've clipped until they come off relatively clean. And he's quite clean today, so we don't have a lot of work to do. And the areas we clip are so that the sensors can sit directly over top of the muscle belly, so between the origin and insertion points of the muscle. So we find these locations based on anatomical landmarks. This isn't very safe. There we go. Okay, so once the areas have been wiped, we can put our sensors on, and the electrodes have to go in the direction of the muscle fiber. So in the splenius, we see the muscle fibers going this way. So put the sensors over top. And then when we're collecting the data, we have to keep an eye on the sensors to make sure they don't fall off in between. It's okay. Good boy. It is warm today. If you just get it in the middle here. Just flip them on. That one's going to come off. Thank you. Just one.
Sorry. One's dropped off.
That's okay. Oh. Where? Oh. Can we just get another marker for his fetlock? Just got one. Oh, I guess we're not collecting canner data. Sarah, I was going to collect canner first. I was going to collect the canter first. Thank you. Okay, so once they're on, we flick the sensors on, and you'll see them flashing lights. And we'll just open QTM, which is the program that we use to collect our data. Okay, so if we open a new file, here you can see, oh, it's not as clear anymore, but you can see what all 8 cameras are viewing right now. So we use a trigger, and this is to ensure that the kinematics and the EMG data are coming in sync. So obviously, if we want to link our movement to the muscle activity, we need to ensure that our data is coming in at the exact same time, which is why we use this trigger. So if we collect some canter data whenever you're ready, Laura, and on the screen you'll just see the kinematics and the EMG data coming through. Okay, so could everyone see the markers going through? So that's essentially what the kinematics look like. At the bottom here, the sunlight's coming through, so I don't know how clear it is, but you can see our EMG signals. So channel 1 here is our splenius, the one that we placed on the upper part of the neck. Channel 2 is our trapezius, the one closer to the cantle of the saddle, the pommel. Channel 3 is our triceps, so the muscle on the shoulder. 4 is our superficial glute, and 5 is our biceps femoris. So these are our raw signals, and by raw we mean that they haven't been formatted in any way. So one of the things that we have to work with when we're collecting this kind of data is that we get movement of the sensors on the skin, and that's called noise. So we can actually filter our signals to remove this noise using a high-pass filter. And this eliminates that baseline or that noise that we see from the sensors moving on the skin without actually taking anything away from our EMG signal. So before we actually do any analysis on the signals, we'll perform a high-pass filter over the signals. So now we're going to collect data from a 1 meter vertical. And this is what I use, this is the kind of setup that I use to compare the data between elite and non-elite horses. So obviously with my non-elite horses, I couldn't really ask them to jump much higher than a meter. And I needed to be able to directly compare the muscle activity. So we collected data from horses at Laura's yard, so for my elite group, as well as at another elite rider's yard. And we also collected data from non-elite horses, which I'll show you in a moment, from mainly school horses. So they were fit enough to jump a meter, but I couldn't ask them to do much more. So here we'll just collect data from Laura jumping over this vertical fence whenever she's ready. Just check the markers. Okay? Right, whenever you're ready. So this one's going to come through a bit faster because obviously she's going to be traveling at a faster speed. Oh, which one? Oh, yeah, okay. Can we just get another sensor? These are the difficulties that come with it. We'll just put that one back on, Laura. Right, there you go. Okay. Okay, so that was our jump. These are the EMG signals that we would collect from a jump. You can see already a different pattern from the canter. So we can see this quiet period. And what we're seeing in the signals, these bursts in the signal are essentially when the muscle is contracting or when it's active or working. So without actually looking at the kinematic data, we can see here that at takeoff, there's big bursts in the muscle, and there's actually a quiet period when the horse is in jump suspension. Again, these are our raw signals just from a 1 meter fence. So we would put some filters on them to take out some of the noise that you're seeing, especially in this signal here, which is the triceps muscle. And we get a cleaner signal because we've removed the noise from it. So we'll collect some data over a 1.20 meter fence now. I think we'll put it up to an oxer if Laura's wanting to do that. Any questions so far about the data collection or, yeah? Yeah, so this trigger is connected to in the back of camera 1, which Johnny could point to. And it's also connected to the EMG box, which you can see there, which all the sensors are sitting in. And it essentially allows us to set both systems off at the exact same time. There's obviously a little bit of a time delay when you're capturing the data, so you'll see before I turned the thing off by accident, you'll see that the kinematics are coming through and the EMG is like a little bit delayed. But when you put the signals together in your data analysis, the timing is the exact same. Any other questions? Yeah?
I'm just wondering, on the graphs that you have there, the amount of muscle contraction, can you put that into like a measurable volume?
Yeah, these are obviously our raw signals, so I'll talk to you about how we actually analyze the EMG signals once we've collected the data and show you my findings.
And in terms of, can you actually measure using this system? Can you actually measure how much muscle strain is too much and might be causing injury?
I think that is a question that would be very difficult to answer, even if you could measure. I mean, you can look at how much work the muscle is doing, but it's the same as, bones and tendons. We know that we can load them so much, but how much is too much? That threshold hasn't really been determined in terms of musculoskeletal injury. So if someone was to say for definite, this muscle is working this hard and therefore you're more likely to cause an injury, then yeah, we could measure that with the EMG and find out, when it was working too hard. But I think someone needs to actually figure out what that threshold is first before we could do that. Okay, so we've got our big fence up now. Any other questions? No? Okay. So the kinematics that I'm collecting here, obviously I link them to what's happening in the muscles. And we know what people look for generally when they're looking at the movement of a show jumping horse. So, like for instance, with Laura's horses, I can look at the movement of their forelimb, how much they're tucking, etc., and link that to the muscle activity patterns that are happening to facilitate that movement. I can also do the same thing in the non-elite horses, so I can look at the kinematics from them and link that to their EMG data. So, are they working harder to get over the fences or to lift their forelimb up? I can look at all those things with the EMG signal and the kinematics combined, and I'll show you that once we've collected the data. Good? We'll do one more a bit higher, if she wants to. Okay, so this is what we're getting over in Oxer. Again, with this data, what we can look at, and mainly just out of interest, because obviously I can't ask my non-elite horses to jump 1.20 meter Oxer, which is what Laura's just done. But I can use this data to look at the differences in how much harder the horses have to work or their muscles have to work to get over a larger fence or a spread fence. Also, we can look at the differences in the kinematics over a larger fence as well, and look at what elite horses, what strategies they're actually using to get themselves over these fences. So I think we'll put the fence up a little bit higher and just collect one more trial. Any questions from that? Okay. Okay, so we'll just collect one more trial and then just start looking at the data. Just double check that they're all on. Ready? Sorry? Oh, right. Okay. Okay. Oh. The horse is very warm, so this is why we're struggling to keep the markers on. Okay, so we'll just collect our last trial from him. Okay, so this is the data that we're seeing from a 1.40 meter fence. We're seeing the same pattern that we're seeing in the lower fences, but obviously we need to analyze the signals to look at how much more work the muscles are doing. So these are the typical signals that you would see from a canter. Obviously it's just from one horse, but this is generally what the signals will look like, the EMG signals look like in a canter. So obviously, just due to time, we'll focus in on 3 muscles today to look at in a bit more depth. So if we focus in on the splenius, the neck muscle, and our 2 hind limb muscles, the superficial glute and the biceps femoris. So these are those 3 signals. So again, like I said, the bursts that you're seeing are the muscle contractions. So essentially when the muscle is active or working. Now, in order to link our muscle activity data to the movement, which is what we're most interested in doing, we need to put some gait events onto the signals. So in biomechanics, a stride or consecutive strides are generally demarcated by the impact of the hind limb, so when the hoof hits the ground. So I've put those events on the signals, and they're represented by the black vertical lines. So these are when you're seeing hind limb impact, which was derived from the kinematic data. And in between these 2 vertical lines is the muscle activity that we're seeing during the stride. So if we want to go a little bit farther into this, we can split the stride into stance and swing phase. So stance phase is when the hoof is in contact with the ground between our hoof impact and our hoof liftoff event. So if I put those events on the signal, hoof on is our blue lines and hoof off is our red lines. In the last signal, I've obviously had to make the line black because it's a red signal. So between here, we're seeing our stance phases in yellow. And we can also split it into swing phase, which is the areas that are not highlighted. And swing phase is when the limb is not in contact with the ground, so when we're seeing protraction or retraction of the limb. So what do we see here? Well, we see that our 2 hind limb muscles are active during stance phase. And this makes sense because we know that they're hip extensors and we know that they're responsible for a lot of the power that we see to propel the horse forward in canter. In the neck muscle, we see that it's active in the middle of stance and going into swing phase. Now this is also understandable because we know that during canter in the suspension phase, the neck is lifted to help balance the horse and offload the forelimb. So that would explain why we're seeing that kind of activity. So I was asked about how can you kind of tell quantitatively how much work the muscle is doing. So in order to do this, we need to do something called full wave rectifying the signal. And it actually is quite simple. All we're doing is taking the negative values in the signal, so the values that below 0 that you're seeing here, and turning them into positives. And we get a signal that looks something like this. So in order to look at how much work the muscle's doing, we calculate something called the integral, or the integrated EMG value. So IEMG is what it's shortened to. And to calculate this, we measure the area under the signal. So it's essentially the same as measuring the area under a curve between 2 events. So here, if we wanted to look at how much work the muscle was doing in one stride, we would measure the IEMG, calculate the IEMG between our 2 hoof impact events. And I'll get back to this in a moment. So this is what the data looks like from our typical meter vertical fence. And if we again look in at those 3 muscles, we can see that the activity pattern, timing-wise, is obviously quite different to the canter. So the jump stride is split up a bit differently than your normal canter stride. And this terminology was described by Dr. Clayton, so you can read up on it a bit more if you want. But essentially, we break the jump down into the approach stride, the jump stride, and the departure stride. So we can further split the jump stride down into 3 phases, which are our takeoff, our jump suspension, and our landing phase. Now, just to give you a bit more insight into that, our approach stride are all the strides that come before the fence, but our approach stride 1 is the stride right before the fence. So here we see kinematic differences between a normal canter stride. One of the main things that we're seeing is the forelimb lifting, beginning to initiate the upward movement before takeoff. So we can see in this phase extension of the neck, which starts to lift the forehand. And this allows the hind limb to swing under for the takeoff phase. So the takeoff phase is essentially the stance phase of the 2 hind limbs, which Hillary talked about a little bit in her talk. And generally, we see the hind limbs hopefully pushing off the ground at the exact same time. The takeoff is where the power is generated to get over the fence. And it's also one of the most important phases because this is the phase where the trajectory of the horse is made over the jump. And this trajectory can't be altered once the horse is in the air, so this phase is very important. At jump suspension, this is when the horse is airborne. Again, the trajectory has already been determined at this point, so we're essentially seeing the effects of inertia. At landing, this is comprised of the stance phases of the forelimbs after the fence until the impact of the hind limb. And here we see the neck raised again to change the rotation of the trunk. So if we didn't have this neck lifting up, changing the rotation of the trunk, essentially the horse would fall on its face. So this is very important to rebalance the horse. Also, the lifting of the neck helps to offload the forelimb. And at departure, we see the hind limbs making contact with the ground and initiating the forward movement away from the fence. Okay, so if we look at those strides again, or those different phases in relation to the muscle activity, it actually makes quite a bit of sense. So at the approach stride, we're seeing a similar muscle activity pattern happening to the canter, where it's active during the beginning or the stance phase. In the splenius, we're also seeing a lot more muscle activity that we saw during the canter. And during the approach phase, we know that this is when the neck's lifted to start initiating the upward movement of the forehand. This neck muscle is quiet during takeoff, but we see these large bursts in activity in the hind limb muscles because we know they're generating the power. In both muscles, we see a quiet phase during the suspension. So we see a lot less muscle activity happening once the horse is actually airborne. The hind limb muscles are still quiet during landing phase as they haven't made contact with the ground yet. And we see a burst of activity in the neck muscle at landing, which again makes sense because we know that the neck is lifted to rebalance the horse and to help offload the forelimb. And then again, we're seeing these large bursts in activity at departure as the hind limb propels the horse forward away from the fence. So these are our 2 different signals from jump and canter overlaid. The blue is obviously related to the canter, and the red is our jump signal. So we know that there's obvious timing differences between the 2, but what if we want to know how much harder the muscles are working in the jump compared to the canter? Well, to do this, we need to rectify the signal, which I described to you earlier, and calculate the integrated EMG between events. So to look at the differences between the jump and canter, I calculated my integrated EMG values, so the area under the signal between 2 events, and the events that I used were stance phase at the approach, takeoff, and landing phases. For the muscles of the forehand, I used forelimb stance phases because obviously those muscles work with the forelimb. And for the hind limb muscles, I looked at hind limb stance phase because obviously they are working for the hind limb. Oh, also another thing, the EMG signal varies quite a bit over time, or especially with individuals, and there's a number of factors that this is due to. So in order to make my values comparable between individuals, so between the group of horses that I analyzed from Laura's yard, we need to do something called normalizing the signal. And this allows us to directly compare. So normalization, it's commonly used in EMG. And essentially what we do is we find our maximum IEMG value and use that as a reference point. And we relate all of our other IEMG values to the maximum. So basically, all we do is divide our values by the maximum, which gives us a percentage output, so a percentage of the maximum value. Hopefully that makes sense. I think it will in a minute. So these are my normalized values, averaged over the 4 horses from Laura's yard. And what we're seeing here is the amount of the IEMG values in relation to the maximum canter value. So they're in percentages, and to look at how much more work was being done, I'd calculated the percent change. So in jump approach, we saw a 76% increase in the work done by the muscles of the superficial glute from canter. At takeoff, a 625% increase in the work done, and at jump landing, a 38% increase. If we look at the biceps femoris muscle, we see a similar trend, a 96% increase from canter to jump approach, a 340% increase from canter to jump takeoff, and a 128% increase from canter to jump landing. In the neck muscle, we see a similar trend, but not as drastic values. So only a 7% increase in jump approach to canter, which is quite interesting. 123% increase in muscle activity at jump takeoff, and 18% at jump landing. Okay, so we see that clearly there's a lot more work done by the muscles over the fences, which we would expect, but here we have actual quantitative data to show actually how much more is being done. So what about our non-elite horses? Well, this was the second question that I wanted to answer today, is what is the differences that occur between elite and non-elite horses? So these are 2 examples of the non-elite horses that I collected data from. They were school horses that were obviously physically fit, but probably not going to make it to the elite level anytime soon. So this is a typical signal that we saw from our non-elite horses. So we're seeing the same activity pattern to the elite horses, or very similar. And the main difference that we notice is the difference in magnitude of the signal. So it's quite a bit higher than our non-elite horses. This is your typical jump signal from a non-elite horse. And again, we're seeing the same muscular pattern, but I think this slide shows more obviously how much more muscle activity we're seeing in terms of the magnitude of the signal. So we're seeing a much bigger signal. Okay, so if we look at the normalized data from our non-elite horses, what were the differences that we saw between canter and jump? So I'll just look at the hind limb muscles for now, just because of time. But in the superficial glute, we saw an increase of 200% at takeoff, 883, at takeoff, and 99% at jump landing. So if we compare these values to the elite horses, which are in white, obviously our non-elite horses are working quite a bit harder than Laura's group of horses that we analyzed. In the biceps femoris, we see an 84% increase in approach, 415 at takeoff, and 213 at landing. So again, if we compare these to our elite values, interestingly, we don't see as much of an increase in the work done at jump approach, but we are seeing quite a bit more work done at takeoff and landing. And this might be reflective of the fact that these non-elite horses aren't as efficient over a fence. So they're not working as hard at jump approach as they should be, but they've got to make up for it during the takeoff and the landing. Okay, so we know this information. How can we actually use it to inform practice, which is what the whole point of this research was, to help try and scientifically inform our very anecdotal training methods that we use. So to make sure that my research was relevant and could be applied, hopefully, in future, I conducted a questionnaire. I got 226 respondents, and they ranged from fellows of the BHS to Pony Club members, and I also got some results from international equestrians. Now, from the questionnaire, I wanted to look at what these equestrians look at when they're evaluating quality movement and performance in the jumping athlete. So obviously this would help me to analyze my kinematic data and focus in on the aspects that were actually important to the equestrian. The fence type and arrangement that they would use to evaluate jump technique, this just helped inform my data collection procedures. And finally, the training methods that they would commonly use for the equine jumping athletes. So we'll link our findings to this today, or try to. Obviously, I'm at a very preliminary stage, so what we found from our higher level riders, riders, trainers, or coaches actually, and I classed these people as people that had at least BHS intermediate instructors, or were competing at Fox Hunter or higher. So I wanted very high-level riders to inform this questionnaire. And what I found was that they placed the most importance of their training program, or the highest relevance, on the quality of canter, if we're looking at the very important section of the bar graph here. Followed by stride adjustability, and the thing that they ranked still important, but the least of those three, was the jump technique. So if we looked a bit further into this, I asked what the typical components of the training program would be, and flat work and hacking came out on top. So what did I actually draw from this section? Well, from the high-level riders, coaches, and trainers, I found that there's an emphasis placed on quality canter and stride adjustability, which they work on through flat work and hacking, and there's less emphasis on actual jump training. So if we get Laura to comment on this, would you say that this kind of mimics your training programs and how you train your horses at home?
Yeah, it's very similar to the way we train ours, mainly with the dressage and flat work, or just hacking, and sometimes a small jump before a show, but not too much.
And how would you say that your training might differ from, an amateur rider?
We ride them in hard canter work, so they adjust the stride a lot and they work through the muscles in their back, so it's not much different to the way they canter when they're actually in the ring.
Great. So from the questionnaire and from, anecdotal experience, and obviously Laura's experience, we know that there is a difference between the way that elite riders and non-elite riders train their horses. So we'll see a lot more jumping done by the non-elite riders. Would you agree with that? And so obviously I can't draw too many conclusions on making actual recommendations to how we train our horses at this point in my research. But from what Laura said, from what we know from the questionnaire, and from the science that we've seen today, the actual concrete numbers, we can see that a training method that places more emphasis on flat work and less emphasis on actual jumping results in a horse, when done correctly, can result in a horse that is more effective and uses itself more efficiently over a fence. So that's all I can really talk about today in terms of how far I've gotten with my research. But just to conclude, we know that EMG provides a non-invasive way of looking at muscle activity patterns in the horses. This information can form the building blocks that we need to understand the movement patterns in the horse, so to fully understand what our kinematics are telling us. And further work will hopefully allow us to objectively inform or justify the predominantly anecdotal training methods that we use currently. And we've only really just scratched the surface here. I mean, research has been done using EMG in the horse, but there's still a lot that we need to look into using studies like this. So that's all for now. Any questions?